Good Monday morning, everyone. I'm Dr. David Wild, Vice President of Performance Improvement here at the University of Kansas Health System, in for Dr. Steve Stites today. We are coming to you live again from the Dolph Simons Jr. Family Broadcast Studio. This morning, Dr. Kenny Southwick, the Executive Director for the Cooperating School Districts of Greater Kansas City, is here with Dr. Jennifer Watts, Pediatric Emergency Physician from Children's Mercy, and we're talking about all things teacher vaccinations today. But first, this is a bit of a monumental week. Today marks the anniversary of our first patient being admitted here at the health system for COVID-19. I remember that day and everything that has really ensued pretty clearly.
Yeah.
It's pretty amazing to think about all that's happened in a year.
Yeah, I remember that first day. It was like phone meetings almost all day. It was just a lot of trepidation and not knowing what we are going to be doing and what happens if we get two patients and so on. So it's been a heck of a ride for sure.
It has. And as I think back on that just a little bit and reflect on what all has changed and really all of the efforts of so many people here inside our organization and across the community, I can't help but be a little bit humbled and very impressed that it's been quite a ride. Something that many of us never expected, and clearly something that none of us had ever experienced, a pandemic of this nature lasting a year or more, right? 100 years since the last time that happened. But nonetheless, very proud of the way we have continued to do everything we can to share with you all what is important, and maybe to help clarify some things that might be unclear, especially in a set of circumstances where we've been learning so rapidly, which is new for almost all of us. So with that, Dana, how are we doing this morning with numbers here and in Hays?
You know, we're doing pretty good. Like I said, with that first patient, we were scared. And what happens if we get two? We know how many acute active infections we've had in the hospital. Over 100 at least. Right now, our active infections are down. So 14 active infections with 3 in the ICU and 2 on the ventilator. We still do have 23 in that recovery mode. So under 40 total patients in the hospital, which I think we are pretty happy about. We've continued to be happy for these last few weeks on overall the number of patients. Obviously would like to see that 0, but I think we're doing good as far as that goes. And then for Hays as well, they are doing very well. 9 total patients with only 2 in the active infection time frame and 7 in that recovery mode. So
definitely good news out there.
Yeah.
You know, it's interesting. If we say our number is 40-ish, that's really where we were in August.
I'll say,
late summer, going into the fall before the big surge of November. And at the time, that seemed almost insurmountable. 40 seemed like it was impossible to manage. And wow, what a difference a couple of months makes. Before we jump too much into our discussion about vaccines today, are there any reporter questions on the line?
Hi, this is Jordan Batts from Channel 41. Happy Monday.
Happy Monday.
Hi. So, you guys were just talking about that 1 year mark. I would like to know personally, what has been the last year been like for you guys? And really also, what have you learned in the past year?
That's pretty much a whole week's worth of answers, I think. Maybe I'll start with a couple of things and then pass it off to Dana. So I think the last year for many of us has been the same as it, or similar maybe, the challenges to those that most of our community has faced, right? A lot of fear. At times I can remember so many conversations with our own physicians and providers, nursing staff, respiratory therapists, in March and April and May even. Is it safe for me to go home to my children? Am I going to hurt my family because I'm taking care of my patients? And those sorts of fears, while maybe a little bit different from the fears of those who work in other industries, are sort of the same as that we're hearing from people now. If I go help take care of my 70-year-old grandmother, am I potentially putting them at risk? May I hurt them? Is there a risk for me doing that? So those sorts of fears, I think, are present for almost all of us in healthcare, although they've changed over the course of time. Personally, then, for me, the other things that we've been dealing with, of course, lots of unknowns, lots of learning, lots of paying attention to maybe incomplete data that comes out that helps us inform some strategy or actions early on that then gets modified in time because we learn more, and not changes dramatically, right? I don't think we've really had much that's been a 180-degree turn, but we learn more and we understand what maybe we can do a little differently and what we shouldn't be doing, and then tackle that or combine that with tackling, a lot of emotion from the community, from our families, from the people that we work with every day, especially as we got tired and close to overwhelmed, but never really completely overwhelmed to the point that we were not providing the quality of care that we're used to our patients. And then there's this whole thing. I wouldn't have expected to even be a couple of times a month playing on the studio set here and in this role. So lots different for me.
Yeah. I mean, I think certainly individually, yeah. I mean, my schedule has changed. There's a lot. It's a lot more work, a lot more meetings. I think in general for the health system, we've learned about new science and medicine. We've learned about new safety protocols and procedures which have worked well to keep our patients safe, our employees safe. I think as a society we have learned, if you didn't know about the inequalities before or weren't paying attention to the inequalities, we've learned more about the expanse of those inequalities for different populations, whether that's social injustice or medical therapy and treatment. The risks that people live in every day. We saw that the hardest hit communities were those with multi-generational living and lots of people living together. So we've learned about other aspects of society, but we've also learned that there have been good things that have hopefully will come out of this. We've learned about the infrastructures for public health or the lack thereof. And hopefully moving forward, we can work harder or more efficiently and smarter to correct all of those things that we've seen now that have been even further exposed since the pandemic in this past year.
No doubt all those challenges have existed. And of course, there are also some silver linings. We've talked at length about how health systems and physician leaders across the metro have worked together in ways that we probably didn't before this. We've also made lots of friends that we maybe knew and were friends with, but not nearly as close with as you sort of gain a different perspective and a different level of trust and respect as you work, I'll say, in the trenches, if you will, with people regularly. There's a good group of us here at the health system on the infection prevention side that have a text string going, and there's a lot of great friendships. We were talking last night about how we figure out how, for example, to get a group bike ride together here, something that we wouldn't have had the time to do maybe when it was warm enough to do outside activities in the last year or so, but we're definitely looking forward to now. So silver linings without a doubt as well. Just a lot different, I think, to summarize.
Thank you.
Sure. Any other questions this morning? Great. All right. Well, Dr. Southwick, thanks for being with us this morning. If you will, let's start by taking just a moment and sort of reminding us about your role and about the educators and districts that you represent and serve.
Yeah, so thanks for having me. I appreciate it. I serve as the executive director for the cooperating school districts of Greater Kansas City after a 40-plus year career as a teacher, coach, counselor, administrator, superintendent for public schools for all those years. Right now, we serve 32 school districts on the Missouri side. We go as far north as St. Joe. We go as far south as to Adrian, Archie. We go out to Knob-Noster, Lexington, and really encompass most of the school districts in between. And during COVID, I think one of the good things that comes out is collaboration. And we have done a lot more collaboration with different agencies, but a lot with the school districts on the Kansas side as we've tried to navigate COVID. So we're a support agency. And I remember a year ago when we pulled our first meeting together, and our big thing was, well, we're going to listen to the health department, so we're not going to worry about any of that, but we need to figure out how to feed kids while they're home. And then what do we do with people when they come back, whether we're going to quarantine before we bring them back to school after spring break? Those we thought were our two biggest issues. As we all know, it didn't prove to be that way. So again, just trying to collaborate with Mark and the MACG group and Kaufman Foundation and the good people on your network here with the University of Kansas to support school districts best we can.
You know, I can remember a handful of different conversations and group meetings, some of them you outlined there, where we, as the health system, had some interaction to provide a little bit of guidance or support or review policies. And I can speak firsthand, I hadn't recognized it probably. You know, Dana mentioned some of the sort of differences in different communities with resources, whether it pertains to health or education. I didn't realize the impact for so many kids in the metro area, as you mentioned, around food and how we're going to feed breakfast and lunch for so many children, and also how so many children in some areas, in some groups in the metro, some school districts, didn't have access to the same degree of internet or technology support to be able to learn in the same way from home. And hearing those things as part of the challenge that you and really all of the educators across our community were working on at the same time as you were trying to understand how do we keep kids healthy when they do get back in the classroom, as important as that is. It was a huge learning moment for me. Very eye-opening that the degree of focus on the overall benefit, health, safety, and really success of the children in our community, the level of focus from our educators. So for that, for me personally, thank you for that eye-opening experience, but also for that commitment, because I'm not sure that everyone recognizes just how hard and how everyone in the education realm has been working, and how big of advocates you all really are for the children in our community. So thank you.
Yeah, and I just want to say I think the thanks goes to our bus drivers that have made it work, our cooks, the custodians, the teachers, God love them, and the paraprofessionals, and on up the chain with administrators and boards of ed that really had to wrestle with very tough decisions and a lot of criticism along the way, trying to figure out what was best. And sometimes when the information's balanced one way or the other, and you've got to make a decision based upon in your heart what you think is best, a lot of tough decisions that have been made. So my thanks goes to them. I've been blessed to be just a part of it, to try to coordinate along the way and keep people together. But they've done the heavy lifting.
Yeah, pretty amazing to watch. Let's move just a little bit to vaccines and how, from your perspective, the big picture looks around vaccination in schools today.
Well, I think there's good news that we've had over the last couple of weeks. Obviously, the announcement that the administration has secured additional vaccines to come across the country. We were looking because of vaccine shortage and probably not even being able to get all of our people vaccinated in Missouri until maybe the summertime. Now we have hopes with numbers of vaccines that are coming to the state. As you know, there was a little bit of disparity between Kansas and Missouri. And, state line, it divides us, but, we live right across the street from each other, and we're a metro area. Kansas tiered system for vaccines was different. It was a 1, 2, 3, 4, 5. On Missouri, it was much more complicated, a 1A and a 1B, and then tier 1, tier 2, tier 3, which is where all of the educators lie. And we were looking at vaccinations just across the street with a large portion of school people being eligible for vaccines. And our people were told by our state health department that it would be in the middle of April. So that was hard for us to swallow. I think we got active. Our organization sent a letter to the governor with 32 of our school districts signed on saying, please, we stand ready to help. But if we want to get our schools open and we want them to be safe, we've got to have those vaccinations. So the governor did come out and say March 15th, Tier 3 will open up. We've got the governor that now, hopefully the plan will be in line with the vaccine distribution. And we're seeing vaccines go up. But for us, I think in Missouri, we're going to lag behind Kansas. We know that. We know we're going to get vaccines, but we're really going to need the good help of organizations like your own to look at these mass vaccination sites, to be able to bring vaccines to schools and have people trained to put the shots in the arm. That's a concern that we have right now, that even when the vaccines come, will we have the people trained to be able to get them in? We've been asked to do something that we would never do, and that is put our kids and our teachers and our staff in a situation where they may not be safe. But they've done a remarkable job through following the guidelines of CDC and you guys, but we still want vaccines. We need the vaccines. So.
Sure. You know, we hear very frequently from teachers wanting the vaccine, right? Questions about where can I get it, when can I get it. Have you heard much, though, about vaccine hesitancy in the teaching population?
Yeah, we've been working with our superintendents. We know that by and large, across our system, the majority of our staff are going to be willing to get the shot. There is hesitancy. As a matter of fact, I was on a call with a person from your organization, Gail, I think it's Schweitzer, and we're going to work on some information that can go to school districts around hesitancy, trying to make sure that we make sure people are comfortable, particularly those families that might be in the child rearing years, and whether or not that will be safe or not. So we're working to get that information out, trying to get as many of our staff to take the shot. But by and large percentages of our staff are going to be ready to take the shot.
Great. And yeah, you mentioned conversations with some of our team about sharing information, connecting our experts in our obstetrics and gynecology department, for example, to talk about those potential impacts or fears about impacts around those who might be pregnant, or for those who are battling with infertility. So those questions have been frequent in other groups, and I think we have been very clear that if there's a way we can help spread that message and answer those questions for educators across the metro, we'd be happy to do so. You know, there was some talk recently about surveillance among teachers, so looking for variants and watching for variants in our schools by a sort of formal plan of surveillance among teachers. Is that happening now?
I'm going to tell you, to the degree that it needs to happen, I don't think it's happening anywhere. In the state of Missouri, and I can't really speak for Kansas. I think it's one of the things that we've got to step up. You know, early on, testing was not going to be a responsibility of the school district. The contact tracing was not going to be, but it basically fell in our arms in the end to make sure that when we had people that had to go to testing, that had to be quarantined, we basically took care of that, because quite honestly, our understaffed and underfunded health departments really didn't have the ability to do that. We are hoping that when the rescue plan comes down, and when we've looked at the distribution of the CARES money from the last act, that there'll be opportunities for us to put strategies in place. Variants are a concern for our school districts, given the fact that we've been able to control numbers in our schools. A lot of that has been because we've had anywhere from 7 to 35% of our students have been out in remote, and a lot of our districts have been in hybrid, and a few of ours have been able to pull off the social distancing and following the guidelines to be face-to-face. But when you bring all of our students back into the buildings, which is our goal, it has been since the very beginning, some of the things that we've been able to do in mitigation will become much tougher. It'll take a lot more work. We're hoping that there would be some dollars that we could funnel off, work with additional agencies to get that data so we can continue to make the good decisions that need to be made in COVID.
Yeah, all makes sense. Dr. Watts, let's bring you into the conversation. You're an emergency medicine physician, but you also are the director of global health education for residents and fellows in the pediatrics programs at Children's Mercy. Tell us a little bit about that and how the pandemic has impacted that work.
Yeah, I can tell you my main role at Children's Mercy has always been in global health education. Some of my expertise is in international disaster relief. And so when the pandemic hit in Kansas City, I got pulled quickly into our response and where we are and what our role is in the COVID response in the Kansas City region. And since then, my job has morphed quite a bit since international borders shut down. And, we did a lot more on the pediatric side with COVID. I stayed in the, disaster preparedness, emergency management role at Children's Mercy. And that clearly has morphed my career moving forward with, having this dual role of emergency management as well as, working on getting our residents back into their international rotations, working with our international communities, even within the region. So I will certainly continue both of those roles moving forward.
I can speak from personal experience, more phone calls than I can count with Jen, talking about all kinds of things, whether it was early on in the process and or in the pandemic and this really growing concern around what sort of the inflammatory consequences might look like in children, the multi-system inflammatory syndrome in children, or more recently about vaccination for populations that support care of our children, primarily educators. Tell me a little bit about why Children's Mercy and your team really wanted to step up and focus on holding teachers' vaccination clinics across the metro.
Sure. I think we've, you hit it, pretty spot on. Our role has morphed over time. I mean, at the beginning, we were, just like everybody, what does this mean? When this started in February and March, nobody really knew what COVID-19 was going to do to children either. And so our preparedness efforts were very similar to every other hospital. We worked a lot with infection prevention and standing up all the key markers. The same fear was certainly present at Children's Mercy, just like it was at all the other hospitals. And we still have that today because we still treat COVID-19. It's just typically not in the same manner as, as it is in the adult population. We did morph some into, the multi-inflammatory syndrome for children with, the reactions after COVID. And we did a lot of education work. Some of our infectious disease doctors were involved in national databases and gathering information to describe that and to have some of that cutting edge information. We also worked early on with a lot of the schools and a lot of the districts. Even last year, everybody, when the city shut down and the schools all, kind of closed the doors and everybody went virtual after spring break last year, we started working over the summer with how are schools going to reopen. Some schools were very eager to try to get kids back as safely as possible. And we started working with some schools as early as the end of the academic calendar year last year. So starting at the beginning of the summer, late spring, beginning of the summer, we began working with some schools on mitigation strategies, how we can assist you and how we can assist the health departments in assisting you to help you bring kids back safely. You guys talked quite a bit about all the implications that school provides and not being in school has on kids' safety and well-being. And we recognize that as pediatricians. And so we did a lot of advocacy working through the AAP channels of both Kansas and Missouri for our region as well. We stood up a portal online where schools could reach out to us. We've had districts, we've had schools, we've had individuals in schools reach out to us on the safety and mitigation strategies that schools could put in place. They could be anything from the, cleaning products that they're using, that some of our environmental team has worked with, to the ductwork and the ventilation systems, to masking, to even training some of our school nurses on how to manage trachs. Children children with tracheostomies that are still receiving education. And, we worked with some of the school nurses on how to safely do that with COVID-19. So our school portal definitely took off. We've had a lot of responses there. We did multiple webinars for educators. I know some of our pediatric infectious disease experts worked with others across the state of Missouri to do a lot of the School Nurse Association. They did weekly, they're still doing them, weekly calls where they can log on, they provide education on a topic, and it's kind of an open forum for them to ask a lot of questions to feel safer. The lift that we have asked our school nurses to take through this pandemic has been astronomical, and they have really stepped up to the plate and have done an amazing job to help our kids return safely and to provide a lot of needs that our kids have for their overall well-being. When it came time to vaccination, we started with vaccinating our employees, just like all of our hospitals did. And once we got through that, the target obviously is in the older age group because of the mortality and morbidity with COVID-19, which makes a lot of sense, but that's also not our patient population. And so we saw a role for Children's Mercy to play to assist with those populations that do provide services with children. So we can help them feel safer, so we can help them have a little bit better sense of security to be in that classroom teaching those kids. And the daycares, we talk a lot about educators, but our childcare providers are a huge role in our economy in the region as well. And there's a lot of us that wouldn't be working, and a lot of healthcare workers that could not have performed their job without their daycares being open. And so we see our role as assisting with K through 12 educators, with childcare providers, and some of the other pockets in the community that do provide childcare services.
So tell me a little bit about how those vaccination clinics for those populations work. Are they set days? Are they the same locations? Do you travel to schools?
Primarily in Johnson County and Jackson County, because that is where we are right now. That's where we are providers for vaccine through the states of Missouri and Kansas. We have worked closely with the Johnson County Health Department. They requested assistance to vaccinate their educators and childcare providers because they had nearly 25,000 of them. Most of the schools in Johnson County have at least been in session for elementary kids. And so it was important for them to figure out a way to get their teachers vaccinated in ways that don't disrupt the classroom as well. So we worked with the county. We've worked very closely with the county. You talk about new friendships, that definitely is a collaboration that has grown through COVID-19 as our collaboration with some of the health departments. But we worked with the counties to try to hit all of the educators, all the childcare providers equally across the county. So all of the districts were asked by the health department to tier their districts, just like the hospitals did with prioritization schedules. And we started with the top tiers, with special ed teachers being the top tier since they have some of the most significant exposures. And the epidemiologist found that they were in quarantine a lot more than most of the educators. So we started with special ed, and then we kind of worked through their tiers as we moved down. So it was equitable across all districts, all of the private schools, and even our child care providers in Johnson County. We worked with 3 of the large districts, Shawnee Mission, Olathe, and Blue Valley, and we have held vaccine clinics at those sites. They have provided the space. They've provided quite a bit of support on site as well. And it has been an amazing collaboration between the health departments and all the school districts to get this accomplished. We are doing our final first dose clinic this week, and we will have all of our second doses completed by the end of March as well. So we've done a large, I don't have the number exactly off the top of my head because we did quite a few last week as well. But we will have reached the majority of the educators and childcare providers through the county by the end of this week for their first dose.
Excellent news. Lots of really hard work. Yeah, Dana's clapping as he should.
That's good.
I think thanks to you and all of your team for that support. I know, as you mentioned, the collaboration among health systems with the county health department, whether it's in Johnson County or Jackson County or Wyandotte County, have all been sources of new relationships, new partnerships, new friendships, and I think I would echo that 100%.
We are excited. I can just touch on Missouri briefly. We are excited to start vaccinating in Missouri as well. Truman Medical Center has taken the lead in Jackson County to take vaccines on site to all of the school districts in Jackson County. Those partnerships and collaborations have been made, and we are supporting Truman's efforts in going on site. We will be providing staff for the efforts because we've been doing this, and we are able to do so in Jackson County as well. So we will start that on the 15th when Governor Parson gave that green light for us to go ahead and start. And the goal is to work through all the school districts in Jackson County as well in the next 3 weeks. And so hopefully by the end of March, early April, the educators in Jackson County as well will have first doses in.
More great news and a tall order in itself to tackle that in 3 weeks. I'll ask you for your prediction on a question that we get all of the time, and you probably know what's coming, but it is, when will we have vaccines for our children? The current EUA, I think, for any of the approved vaccines doesn't include anyone younger than 16. And that question from our own staff, who are parents, and from a number of community avenues comes almost daily. And I know you don't have a crystal ball, but your prediction, at least, on when you think we'll have the ability to start down that path.
We would love for it to be today. We would love to vaccinate kids. I mean, we do that every day anyway with all the childhood immunizations, and so we would like to add this on as another vaccine. But waiting on that data to come in to make sure that the right dose is given to children, to make sure all the safety monitoring has been looked at is critical. I know that, right now Pfizer's approved down to age 16, and then Moderna and Johnson & Johnson are approved down to 18. So we have been able, when we have received Pfizer vaccine, we have been able to vaccinate some of our high-risk patients. According to the Missouri eligibility guidelines, we have been able to target some of them, definitely not all of them, but we have been at least able to start with some of our high-risk patients. The data on the children between 12 and 16 and 12 and 18 is currently underway and well underway. We are hopeful that by the end of summer, early fall, that we will be vaccinating the older teens as well. As you know, an EUA can come out for the age group, but until we are through the tiers that we are currently set in, kids probably won't be prioritized until after all of those adults are done. So the faster we get through adults, the faster we would be able to move into kids as well. But we definitely will need that EUA to come through for that population of 12 to 16. Looking beyond that, we have been approved to be a site for the Moderna study and hopefully Pfizer for all children of all ages. And we have an interest survey right now on our website where parents can enroll their children if they are interested in potentially being enrolled in that vaccine study when the enrollment starts. I know Dr. Pahoud is eager to get going on it, and the last I heard is hopefully that will begin by the end of March or beginning of April, where we will start to enroll children into that study at Children's Mercy. When that data is going to be out is anybody's guess. But I think that, if we could start doing teens by the end of the summer, early fall, maybe if we're lucky, we could go below the age of 12 before the end of 2021. But hopefully by 2022, we will be vaccinating all kids across the board too.
Great. Thanks for tackling what is a nearly impossible question to answer with certainty. But I'm fairly sure as well it's not the first time you've been asked. So, Jill, let's get to some questions from the community this morning.
Yeah, it's been a very robust discussion, but we do have quite a few questions. I'm going to start with Tracy. She wants to know, since you got your crystal ball out, right? When is the end of masking our children in school? What is the end goal? No community spread?
So that's a good question. I think actually it applies to a number of areas and populations outside of the educational realm. I think, there are probably a number of, I'll say, gating measures, if you will, that will lead us to be able to effectively recommend those sorts of decisions. I'll let our guests talk about the school district impact in just a second. But in general, I think I would say part of it is a reduction in community spread. That's definitely a measure, really, really important part of understanding the big picture. But a portion of it as well relates to immunity in the population at hand. So that really relates to vaccination. How many or what percentage of the population has been vaccinated? And so for school districts, for children, as we just talked about, maybe 2022 being the time frame for vaccination for that population, it's probably quite some time before we're not masking for most of our educational endeavors. But Dr. Southwick, Dr. Watts, anything to add there?
Yeah, when we started early in the summer talking about what it would take to bring kids back, masks obviously were a strong recommendation. And we just said, our people aren't going to wear masks. They're not going to. We live here in Missouri and Kansas, and we're not going to wear them. Well, we found that we had a few naysayers, but by and large, our students have been compliant, particularly our elementary kids. In terms of when we get out of it, I think we follow the recommendations of CDC and the local health departments. And when they tell us what to do, that's what we're going to do. Until then, we're not going to make arbitrary decisions like our states do, just to not wear masks and open everything up. Our job is reading, writing, and math and science, and to follow it, and not those other decisions. So I will tell you this, that the last CARES Act that was passed in December allowed for expenditures for PPE until September of 2023. And we spend the money and then we put in for reimbursement. But that gave us some indication that they believe that we could be in this for a while. So we're going to follow the leads of the medical profession, and then we're going to act accordingly.
Yeah. I think masking it's not just for those children in that classroom, it's who they go home to. And are there vulnerable populations that either live in the same household as that child or they see frequently and they need, we've heard about childcare and daycare. A lot of grandparents are providing that childcare and daycare for those kids too. So it's that second or third line infection that you really want to stop the spread as well. So we would all love for our children not to have to wear the masks, but they'll come off when it's safe too. And I think to your point, a lot of it is about the immunity and the vaccination.
I also, will say in the schools, it's not just the masking, it's all of the protocols that are in place. Our janitorial and environmental services crews at all of the schools do so much cleaning each and every night after kids are in school. Some schools are closed on certain days to do mass cleaning. There's a lot of cleaning that goes into this that occur on a regular basis that definitely cannot be understated. There's a lot of mitigation strategies in place where kids are not sharing school supplies like they used to. There's also the distancing piece. There's a lot of other things in place in the schools besides just masking. Where, when is all of that going to end is anybody's guess. What we saw this year, however, is that we didn't see any flu. We had minimal influenza in our children and even across the region. And when you look at schools, influenza is one of the kickers for schools to close, especially in some of the rural environments and schools, because if you have an influenza outbreak and the majority of your schools are out, there are schools that will close because their attendance is so low. And we're not seeing that this year either. So, being able to control influenza a little bit with some of the mitigation strategies in place has been phenomenal to see. And where this will take us is anybody's guess. I think without doubt, we will be masking when we start school in the fall, hopefully. Hopefully we will all start school in the fall. But I think masking and the other mitigation strategies will still be in place there. And I think it's still the community's obligation to do so, to keep everybody safe until everybody in our community has a chance to receive a vaccine and to take all the precautions that people would like to keep themselves safe.
Okay. Georgianne says, great. Thank you, doctors. Good program, good answers. Okay. Jennifer wants to know, as Johnson County schools go back fully in person after spring break, what concerns do you have regarding increased school spread in general and specifically the COVID variants?
Well, I think the primary concern, of course, is that when you have more people and a bigger bubble and more contact, that there's a higher risk for transmission. And when you add in variables like variants that might be more transmissible, there's always the concern that we sort of see the current trends, which are flat, and it maybe, as I said, August or July numbers turn around and start to go back up. I think that's probably the biggest concern, is that in the unvaccinated population, we start to see a change. And when we know that that still is by far the majority of the population in our community, we're still really not out of the woods, if you will. Dana, anything?
Yeah, I mean, I think it's important to understand, really that de-densification, less people in that physical room is better because you can spread them out better. So that is why masking continues to be so important. Keeping the kids safe. We know that kids are getting together outside of the school, so probably a majority of that spread is going to happen there. Whether it's extracurricular activities or just getting together with friends, we know that happens, really whether school's in session or not. But it's important and vital to try and keep all those adults in that school healthy as well. So continuing to mask, space as much as possible, those things will help reduce any further spread within the schools. And then, of course, as we are able to get our teachers and certified personnel vaccinated, that will help greatly also.
Dr. Watts? Any additions?
There's also the key that, the schools stay in close collaboration with the health departments. Contact tracing is still in place. Those efforts have not decreased at all, and they will continue to be robust as more children return to school. And the close collaboration with the health departments is critical, so people can be placed in quarantine and isolation when appropriate, and outbreaks could be decreased if there is a risk of that. We have been fortunate thus far and data will show you that there is minimal spread within the schools when appropriate mitigation strategies are used. And so as kids, start to return in Johnson County and even across our region, keeping those mitigation strategies in place is critical, as well as continuing to work in close collaboration with the health departments.
Dr. Southwick, anything else from an educator's perspective?
Yeah, just a couple of things. I know as we talk about the 3 or 4 major counties in the area, we spread to Platte County, north to Clay, out to Lafayette, down into Cass. And the situations aren't always the same there, so we need to look at ways that we can continue to provide support for those areas. I know I was lucky enough to get my second shot on Friday through my local health department. I live at Lake Viking and went to Davies County, and I waited in no line. I was blessed to be able to do that. But a lot of people are not going to have the support that we've got in our counties. And the last thing I'd say about in terms of we're kind of where we were a year ago. We need to consider spring breaks and ask our parents, although I know people need a break and they want to get out, they want to travel. I think we need to ask people to be very cautious if they're going to do that. Be careful, because spring break, we don't need to travel all over the country and to foreign countries and then come back and have another event. So ask people to be cautious.
Yeah, that is a great point. We all very clearly remember that spring break trips last year were really the beginning of the tighter controls around mitigation strategies, as we saw people from all over the country end up together in vacation hotspots, whether it be Colorado or or the beach or wherever it was, and that definitely is not something we want to repeat. So thanks for that reminder. It is a key point, I think.
Okay, just a couple more just general questions. Diane said she had a stroke February 26th. It was within 2 weeks of getting the vaccine. Her daughter wonders if there's a correlation.
I'm going to say no. We've had a lot of these things investigated, whether it's deaths. Now, South Korea came out and said the deaths that occurred with the AstraZeneca vaccine trial had nothing to do with the vaccine. We've seen other complications, and we've talked about death will occur in population, or certain things will still continue to occur, whether it's with the vaccine. I think if you actually get COVID-19, your risk of stroke, because we understand what happens to the blood vessel linings, your risk of stroke and other blood clots is a lot higher than getting with the vaccine. So the short answer to that is no. There was most likely nothing to do with the vaccine at all. The vaccines are safe. We haven't seen that in the reporting systems. Go ahead and get the second dose.
Okay, and Becca says, my in-laws just found out they were exposed to someone who tested positive for COVID the day after they saw them, and they want to know, when should they get tested? How should they proceed?
Yeah, I think we have pretty good follow-up testing for people that have been exposed. We would really say, with the new quarantine guidelines, and they're not new anymore, but, you can test as early as 5 days. I think we would probably recommend more maybe that 7-day after exposure. And with that, then, if it's negative, I would certainly recommend a PCR test if you can. I think Kansas requires the PCR, but in CDC guidelines, it's either the antigen or the PCR. I would probably feel more comfortable getting a PCR test probably 7 days after that exposure.
Yeah, 7 or 8 days after that exposure with a PCR test, I think we estimate that 80% or so, maybe even a little bit more, of those who are going to develop infection will test positive, even if they don't have symptoms yet. So that's really the reason for that. At 5 days, it's a much smaller percentage, and so although that's sort of within the guidelines, I would not recommend it. But do follow the quarantine guidelines in the meantime up until testing for anyone who's exposed in that sort of circumstance.
Okay, and Brian, I'm going to ask your question tomorrow, so tune in tomorrow. And I have 2 more questions. One from Barbara. I'm going to let Joanne have the last one. Barbara's question is kind of like what Christy is asking and some others, and it has to do with, got my vaccine, noticing that people on Facebook, once they get their vaccines, they're getting together, they're hugging, they're not wearing masks. Is it okay? Can I do that, please? What do you want to tell Barbara and Christy?
So I'll start with the Swiss cheese analogy, and then someone can save me. So if you remember, way back, we brought this sort of cartoon, and we've shared it as a refresher a couple of times, that each of our mitigation strategies are like sort of a piece of Swiss cheese. And the vaccine is no different. The vaccine is not a silver bullet for so many reasons. And so what I mean by that is masking. One piece of Swiss cheese, right? And the goal here is to line up the pieces of Swiss cheese so that the holes, you have enough cheese that the holes don't actually sort of line up so that the virus can get to you. And so masking is one slice of Swiss cheese, and physical distancing is another slice of Swiss cheese, and early testing for those who are symptomatic is another, and quarantine for those who are exposed is another, and environmental controls like cleaning and hand hygiene are another. And the vaccine is no different. Maybe you can think of it as a really thick slice of cheese with hardly any holes in it, but it doesn't stop the need for any of those others. So that means that having bubbles that are larger and more personal interaction and not physically distancing for things like hugs, those all still put you at some degree of increased risk. And it's really up to you, I suppose, to decide whether that risk is something you're willing to sort of accept in those circumstances. Maybe if it's someone else who's fully vaccinated and you've got masks on and it's the 2-second hug and then you're back to your physical distancing. Maybe if you're going to do it, that's a better way, but it's definitely not something that we would recommend, having lots of close contact regardless of whether you've had the vaccine. Yeah,
we expect guidance to come out about people or parties that are fully vaccinated. And again, fully vaccinated right now means, essentially 2 weeks after that second dose of Moderna and Pfizer, or I think at least 2 weeks after the Johnson & Johnson vaccine. We expect that guidance to come out. Right now, there is no other guidance, but remember, even if you have the vaccine, you can still get the disease. The biggest issue is you are at such greatly reduced risk of going to the hospital and death. But there is still some people who get little to no symptoms from COVID-19, even with the vaccine. So individually, for an example, for me, even if I go out, I'm fully vaccinated, but even if I go out and I get the disease, although I'll probably be fine and I have to go to the hospital, I'm going to miss days of work. So that's the other thing you have to consider is, yes, you may be overall fine, but are you going to miss days of work? That's important for a lot of people to not be able to miss days of work. So there's other issues in there, not just going to the hospital and being on the ventilator, things of that nature. Understand that if you do get symptoms and you are ill, you are probably still going to be have to be held out from work for 10 days or isolating for 10 days.
Okay, and Joanne gets the last question, and then great questions today. We will bring some of them again tomorrow. Joanne says, and I'm asking this one because I had this happen to me, and I never put it together with the shot. Her daughter is a teacher, and she received her first vaccine last Thursday. Now, don't laugh, okay? She said since then, her daughter has had a gurgling stomach. And I've been having that too, but I never put it together with the shot. I just thought maybe I'm hungry or my tummy liked the food that I fed it. Have you guys heard of that? See, I think you're laughing.
I have
you're
not.
Grinning.
No, I mean, I have
It's not hit my radar.
Yeah. Well, Joanne?
And all it talks with our vaccine people and looking at, even people with delayed site reactions, so a week after they can have swelling at the site. We hear about these things afterward, but I haven't heard of that particular thing. So we can certainly keep our eyes and our ears open for that.
Yeah. All right.
Dr. Watts, is that something that you have seen or heard of in a younger population of teachers or others that might be different from the 65 and over crowd that we've spent so much time with?
No, that's certainly not one we have heard anybody say up to this point. So that's interesting.
It is.
All right. Well, thank you all for great questions this morning, as always. Tomorrow, we have Kansas Department of Health and Environment Secretary Dr. Lee Norman back to update us on vaccine rollout and current infection rates in Kansas, and to give us a little bit of insight into what is happening with an Ebola outbreak in the Congo that is definitely hitting our radar. As we wrap up today, though, Dr. Southwick, any final thoughts?
No, I just want to thank you all for your efforts. I think this has proven that if we all work together on this, get on the same path, we've got a chance to get back to some sense of normalcy. So I thank all the efforts that you've talked about. And we stand ready to continue to be a partner after this. We lick this, it's like the doctor said, let's continue to curb influenza and all the other things that we have out there as well. So thank you all.
Thank you. Dr. Watts?
I also want to say my thank you for allowing us the opportunity to be here today. And then just a huge shout out to all the teachers, the child care providers that have been in this from the beginning with us. And doing a lot of the heavy lift in the schools, and we're not there yet. So we can't drop our guard, and we need to keep going to make sure that our kids are able to go back in school, back to school in the fall, and to do all the things that they need to do to be kids. So keep your guard up, and thanks for having us.
Thank you. Dana?
Yeah, kind of to loop around to one of the questions about the variants. Are we concerned about the variants? I think we are concerned about the variants that we know about and the ones we don't, but we also know the best things that we can do right now, especially with so much of the population still unvaccinated, the best things we can do to help protect against that, and that is, keep your distance. Keep spacing, wear your mask, don't meet in large groups, especially inside if you can avoid that at all. We know that doing those things will help reduce the spread of the disease, and overall, then one more step to be able to keep our kids into school and hopefully at some point in time without masks as well. So keep on doing those things. We know they work.
Yeah. I really couldn't say many of those things better than our guests have, and thank Dr. Southwick and Dr. Watts for joining us and for their efforts. As I reflect a little bit as we wrap up today on what the last year has meant and what we're looking for to come in the next year, I mentioned earlier, I'm humbled and actually very proud of the partnerships, for example, that we've talked so much about today, about new friendships and about new ways of working together. And I remain hopeful that that is something that we all learn from and continue, I think, as we all have hit on today. So with that, thank you very much for joining us today, and we'll see you tomorrow.